Hepatitis means inflammation of the liver. Hepatitis can be acute or chronic. The most common forms of hepatitis are hepatitis A, hepatitis B, and hepatitis C. Less common forms of hepatitis are hepatitis D and E. What is the difference between hepatitis A, B, and C? Hepatitis A, B, and C are diseases caused by 3 different viruses. There are different ways to contract the virus, and they can each affect the liver differently. Hepatitis A does not cause chronic liver disease, unlike hepatitis B and C. There are vaccines for hepatitis A and B, but not for hepatitis C. The symptoms of hepatitis A, B, and C are similar, and they include malaise, nausea, mild fever, jaundice, anorexia, abdominal pain, and hepatomegaly. It is possible for hepatitis to attack the liver for years without any symptoms at all, which can be very dangerous. On the right is a picture of a man with jaundice. Hepatitis A is highly contagious and can be transmitted by the fecal-oral route, by person-to-person contact, contaminated food, such as shellfish who have been in contaminated water, poor sanitation, and hygiene. In most cases, hepatitis A goes away on its own, although in some rare cases, hepatitis A can be life-threatening. Hepatitis B is a serious disease that kills more than 780,000 people a year. It is transmitted through an infected person's bodily fluid. Some ways that can happen is through sexual contact, blood transfusion, the use of contaminated needles, such as getting a tattoo or piercing with tools that were not sterilized, from mother to baby during childbirth, razors, and toothbrushes. Hepatitis B can be acute or short-term, although sometimes the virus causes long-term infection and can lead to serious problems such as liver damage, liver failure, and cirrhosis. Cirrhosis is a disease that replaces liver tissues with scar tissue, causing the liver to function improperly. Babies and children are more likely to contract chronic hepatitis B. On the right is a photo of a liver with cirrhosis. In most cases, hepatitis B goes away on its own. It is highly recommended to avoid drugs and alcohol. It is also recommended to eat healthy, drink a lot of water, and get plenty of rest. Most people with chronic hepatitis B live full and active lives by living a healthy lifestyle and getting regular checkups. Although there is no complete cure, there are several antiviral drugs for this disease which helps in reducing the virus's ability to replicate. There is also a hepatitis B vaccination. Hepatitis C is transmitted the same way hepatitis B is, through bodily fluids. Some examples are sharing needles, having unprotected sex. HIV can raise the risk of spreading hepatitis C, and through mother to baby during childbirth. People who received a blood transfusion before 1992 are at risk because before that year blood wasn't screened for the Hep C virus. On the right is a picture of the hepatitis C virus. Hepatitis C is a blood-borne virus. It has infected around 150 million people worldwide and causes approximately 700,000 deaths each year. Out of the 150 million sufferers, 3 million are Americans. For some people, hepatitis C is a short-term illness, but for 70 to 80% of people, it becomes a long-term chronic infection. Although hepatitis C has no vaccine, the good news is there is a cure. Before the cure, sofosbuvir was invented. Patients would go through a different form of treatment called interferon. It caused horrible side effects with no guarantee the treatment would even work. Michael Sophia, who is pictured on the right, is the creator of sofosbuvir. Sofosbuvir is taken by pill form once a day, and it has an incredible virologic response, and there is a 95% cure rate with minimal side effects. Michael Sophia was awarded the Lasker Award in 2016.